Hello, everybody. Welcome to Wednesday on the last week of May. I think it's May 27th today. And because it's Wednesday, we have Dr. Jess Trimble with us. My name's Kelly Baltzell. I'm the CEO and founder of Beyond Indigo Pets. Welcome, Jess.
Thank you. You just gave me a little scare. I didn't realize it was actually the last week of May.
You've been up in the mountains hiking, so you get kind of a free pass with like checking out of reality. I think you were in a better place than the rest of us were. So you have some things about telehealth, because Wednesday's telehealth, telemed day, and then you and I have some show and tell with our side passions, which are gardens. So why don't you take it away with the tip?
Absolutely. So we'll start with our news item of the day. So veterinary telehealth in general has a ton to learn from the human side, obviously. Human telehealth has been around for 20 years or so. They've learned a lot of things. They've done a lot of things right and wrong. And so we're really hoping that it doesn't take veterinary telemedicine 20 years to get to the same spot, but the only way we'll do that is by learning from our human medicine counterparts. So I stumbled across this article that I think was published last week, and I thought it was very interesting and very applicable to private practices specifically. And it was all about what have we learned through this crisis, through this pandemic, and how can we prevent this from ever happening again? And so it talked about the emergency management cycle and about COVID being, not just a disease, but really a slow mass casualty incident. And so how can we use planning for mass casualty incidents to prevent things like this from happening again? And so, of course, they're talking about things that are contagious on a human side, but this is so applicable to things that are contagious on a pet side too. And so it sort of walks us through how we should think about mitigation, preparation, response, and recovery. So for instance, how are we going to prevent this problem from happening in the first place? How are we going to prepare ourselves when this problem does happen? How will we respond? And then what does our recovery period look like? And a lot of people do believe that we are currently in this recovery phase. That is a little debatable right now. Everyone has a different opinion of if we're still in response or recovery and what's going to happen now that we're recovering and people are back together again. Here in Fort Collins, the breweries all opened yesterday, and evidently it was just a whole bunch of people without masks sitting at tables with each other. I really expect that we're going to see a secondary outbreak from this. And so it circles back around to how do we mitigate that? How do we prepare for that? So if we think about this, in a hospital setting, say for instance, you have a distemper outbreak or a parvo outbreak or a feline calicivirus outbreak. There's a ton of contagious diseases that we deal with in humans, in pets, and then diseases that we have to deal with that move from pets to humans, those zoonotic diseases. And so if your hospital hasn't taken the time to think about that emergency management cycle, both for how do we mitigate and prepare for pet illnesses as well as the human illnesses for your staff, how do we tackle both of those issues? I found that this article was really helpful in thinking through that process. And so it was bringing up this idea of what is your crisis standard of care? And the use of telehealth as part of your crisis standard of care was very heavily promoted because it is a part of all of this. We can mitigate contagious diseases through using telehealth. We can prepare for these contagious disease outbreaks by preparing our staff to utilize telehealth, by preparing our telehealth platforms to be the most efficient. We can respond appropriately to these things using telehealth because we're not exposing anybody. And so it really just matches with every single part of this emergency management cycle. And a big moral of this story as well was, now that we've gone this far, there's really no point of return. We're not going to go back to not using it ever again. And so how are we going to ensure that these things that have worked really well in this emergency management cycle, like telehealth, like creating protocols and preparing, how do we ensure that we never go back to not using it again? So really more of a thought exercise than anything, but just really, really valuable, not just for COVID, but for the impending emergencies that every single hospital will go through, whether it is disease in pets, disease in humans, wildfires, earthquakes, floods. This applies to all of it. And having something like this can be the difference between my clinic is drowning and can't pay its employees and can't see patients, or my clinic is struggling, but we're open and we're still seeing patients and we're still seeing helping people and we're still paying our employees. So give it a good read. I thought that was a really great article that had popped up that is helpful for all parts of our life. And we can move on to the tip next. So appropriate charging, I think, is something that we've touched on a few times over the last couple of weeks, but now is an even better time to really tweak what you've been doing and make sure that it's going to be sustainable in the long term. And there's a lot of different things to talk about. And so I'm just going to sort of briefly run through some of these ideas and sort of hopefully get your brain thinking about how you can charge for telehealth better, because you have to charge for it. So a la carte or per service versus a subscription or a wellness plan. There is a place for both of these. I think both are necessary. I personally love subscription and wellness. I can soapbox on that for a while, but it really takes away that pain of paying for people when they've already paid for it as part of their, puppy's wellness plan, or if they're just paying, $10 a month for unlimited use. So subscription plans and wellness plans and telehealth just go hand in hand together. Reduced fee versus full fee. I've seen practices do both ways. With a reduced fee, many will say, oh, my regular exam fee is, we'll say $50. I'm going to charge a telehealth exam fee of $30. If for some reason we can't fix you or help you with this $30 telehealth, then hey, I will give you $20 off your in-office fee. So that's a way that a lot of them do it, but you can absolutely charge full fee as well. I think it's a very case-by-case basis. And that really goes to per service, because obviously a recheck should be different than a sick pet, which should be different than a behavior consult, different than a nutrition consult. So sitting down and thinking through all your different services so you can create your per service menu with approximately how much time it should take, whether or not you need a veterinarian or a vet tech to do it, all things to think through, because your DVM versus technician fees should be different. And a lot of practices often will provide technician, I don't want to say exams because you're not necessarily doing an exam, but a technician appointment for free or extremely cheap, because those technicians are obviously lower cost to use and often can result in just that much stronger of a binding relationship to your clinic by using those free or close to free services. Rechecks versus initials, again, different costs. A new client versus established clients, maybe you do, maybe you don't. It's totally up to you. I really love including telehealth in the cost of a surgery or sick visit. And so if you come to me and we fix your dog's luxating patella, baked into that surgery cost is going to be a telemedicine recheck exam in 2 weeks. If they miss it, not my problem. They paid for it. And that spot was held for them. But that if we said, oh, and that recheck telehealth exam will be $30 in 2 weeks, a lot of your clients are just going to skip it. They don't think they need it. But if they've already paid for it, they'll probably be there. And then also, I love, love, love the idea of if you are only seeing your clients once a year, let's throw in an every 6 month free RVT check-in, where they're literally just, sending a text message or coming through your app and just saying, hey, how's Fluffy? It's been 6 months since we chatted. Just wanted to make sure everything's okay. That only took them like 30 seconds to do. A lot of the time, though, that free check-in can result in, hey, we can do a nutrition consultation with the doctor, or, the doctor should, maybe talk to you about the fact that there is some mild increase in itching. So it's just picking up health problems before they become an issue, having better patient outcomes, and reestablishing that relationship. I can sound like a broken record because I say it every single week, but I'm just such a firm believer in those things. So really think about how you're charging, one, so that you're ensuring you're making money off your services, and two, so you can ensure that your clients are happy with what they're paying and happy with what those services they're receiving really are. So that's what I've got for the tip of the day. It's a hard one. I get it. A lot of people struggle with it, and sometimes you have to play with that a little bit.
And I can imagine you would have to play with it as life changes right now per the cycle that you had on the first page, right? Because like you said, if we have wave 2 or we have some other thing that, I mean, like, come on, be real. We didn't even really think new COVID was here until COVID was here. So if something new comes up, then we're back at the starting gate again, right, of the cycle. And then, what do you do with then what do you do? And then again, all those decisions have to be made. So.
Yep, we've got to be able to stay agile and understand change management practices in order to really develop good systems. And it's not something that a lot of vets have ever had to do in their life. It's a challenge for sure.
It's a challenge for a lot. People don't like to change unless they want to change themselves, which isn't very often. Let's be real. Right? And then you got to kind of get yourself back together. So speaking of ever-going change, one of yours and my passions to get off screens, because that's our balance to life, is the outdoors. I unfortunately do not have the Rocky Mountains in my backyard, but I do have a garden, and you do. So what's the latest on your garden? And then I will give you a little picture show of my garden.
You're talking about having to change yourself personally. This is a personal change I've had to endure because I tend to over-nurture things and drown plants. And so I'm having to force myself to not. But we built a little raised bed about a month ago, and I'm so delighted because all of my tomatoes are, 6-8 inches tall now, and the lettuce is doing well, and the peppers are growing, and the green beans are growing. So that's really exciting. And then today, hopefully, we'll get all the cucumbers and squash in. And then I'm trying to also put in a ton of just pollinator plants. The sweet old guy that owned my house before me put everything in rocks and cactuses. And so I'm ripping it all out and putting in pollinator-friendly plants.
I love that. Congratulations. It looks like you have a blanket flower up there in the left-hand corner. So
yeah, I don't even remember what it's called, but it's pretty and it's natural and it's native and it's pollinator. So I'm really bad about just seeing something that's pretty and buying it and then forgetting what its name is. So.
Yeah, and then it takes over your yard. Okay, so I kind of did the same this Memorial Day weekend. I spent 3.5 days putting in 8 vegetable beds, which I don't have pictures for this time, but I will later. But instead, my iris are up, and they're beautiful, and they're just deep purple color, which, of course, with Beyond Indigo kind of matches the whole Beyond Indigo theme.
It does. It's perfect.
Can you tell I like this color? Yeah. So it's really fun because they only come out once a year, and so it's kind of like this own special show. My perennial bed that you're looking at is 13 years old. When that started, that was a geothermal field that all torn up to put the geothermal in. So that was a mud pit when that started. But everything's kind of coming up, the hostas, the chives, everything. So it just makes my heart happy to see this.
Pretty.
And then I just get outdoors too, which is a good thing. I think we all need sun. I think it's healthy any day of our lives to get sun, but COVID is especially good to get sun on our faces. And this gives you an excuse to do so, right? So, and it just makes my heart happy. So there you go.
Oh, I love it. I'm a little jealous that you can grow hostas. It's almost too sunny here for hostas. It's a good problem to have.
Yeah, no, we do. I have like 10 or 12 different varieties out there. People pass them around like, really, you want another hosta? Sure, I'll just give you a clump of my hosta. Okay, sure.
Okay.
And my whole my whole garden is for pollinators, which is a gardenator garden, I guess. So all my perennials that flower are for bees, hummingbirds, monarchs, those sort of things. So it's pretty fun. We are in the rustic bee zone, which is an endangered species of bee, but they're the big fluffy bees that like all the storybooks are made out of. Mm-hmm. The really fat ones that kind of look like a B-52 bomber coming in. Cute. They're so cute. They're so cute. So So anyway, other people may be like, oh God, they're talking about gardening again. But really, I think the overall message is it's important to have balance in your life and something that brings you joy. If it's not gardening right now, what brings you personal joy? That is something that you should empower and embrace yourself. And also find ways to find some positivity and upliftment in your life, because it's hard. You know, the endurance is hard and life is changing around us everywhere. Like we were talking about bars being open or not open, and restaurants and hair salons, and it depends on the city and the state and the county, and everybody's got something. So what do you do to make yourself feel normal-ish and happy, right? And for you and I, that's garden. There you go. So be aware, audience, you might see more gardening pictures as our plants grow.
Whether you want to or not.
Yeah, exactly. Well, thanks, Jess, for coming. And we'll see you in the first week of June, June 3rd.
Yes, I'll be there.
All right, sounds great. Thank you so much.
Great week.
Bye.